My name is Judith Fokum. I'm currently a primary care physician at the Danvers Women's Center in Danvers, Massachusetts. I attended medical school in Yaoundé, Cameroon, which is a country in West Africa. Has two national languages, French and English, but most of my medical training was done in French. I did a residency there in pediatrics, but then moved over to the US, where I obtained a master's in public health degree at the Boston University and went on to do a residency at the North Shore Medical Center in Salem. After my residency, I was employed by the hospital and worked as a hospitalist there for over 8 years, and now I transitioned to primary care. Growing up in Africa, which is a resource-poor setting, I saw a lot of misery around me, and the question that was on my mind all the time was how I could help, how I could make a difference in people's lives, and that's where it all stemmed from. Unfortunate thing is, in that resource-poor setting, girls are usually not educated. I was, however, fortunate to have a dad who insisted on sending me to school. And in fact, in my family, I'm the first girl to attain a high school degree. And my father was supportive enough to send me to the university, and after which I went to medical school to achieve my goal of trying to make a difference in people's lives. The North Shore Physician Group is an affiliate of the North Shore Medical Center, and this whole group is part of the Partners network and is affiliated with tertiary hospitals like Mass General and Brigham and Women, and so there's an established working relationship with those entities, such that if patients need referral or a higher level of care, the referral is done very easily because of the working relationship that exists between the two entities. When I worked as a hospitalist, I got to see patients when they were most ill, and it's difficult to establish a long-lasting relationship with these patients because you take care of them for 3 to 4 days and you may never see them again, or you may never see their family. But as a primary care now, I get to see my patients, their family, not just once, but over several years, I hope. And with this, I establish a long-lasting relationship with these patients and their families. And that to me is unique. There's nothing that can replace that.